Hey guys, it's Louis here from ndxtesting.com. And in today's video, we're going to discuss 4 key ways to drop blood pressure. But before we get into that, it's important that we understand body foundation. And what I mean by that is we have to be of, number one, proper weight. And also we can't have excessive belly fat, because then if we are overweight, then that could put unnecessary pressure on the cardiovascular system, and that can be a leading cause of anxiety and high blood pressure. Now, and if we have excessive belly fat, then we can also get affected by maybe type 2 diabetes, high blood pressure, anxiety, and all kinds of problems. But let me give you an example. So I saw a patient not too long ago. Now remember, I want you guys to know that I'm not a physician, but I am a registered technologist in the field of electrodiagnostic medicine. So I do nerve examinations. So my specialty is the peripheral nervous system, which is nerves and muscles. So I do nerve examinations and all sorts of neurological studies all day. But I go over a lot of medical history, and I discuss medical conditions with my patients. They tell me their medical conditions. So when I see a patient sometimes before doing the nerve examination, and that patient, let's just say, is 5'3", it's a female, 200 pounds, or maybe a couple of pounds shy of 200, somewhat of excessive belly fat, and that patient is taking medication for anxiety, high blood pressure. That's a problem to me, because what happens is, in one way, the medication is trying to drop the blood pressure and control the diabetes, and in another way, the person maybe has poor nutritional choices and is increasing in weight. So it's very important that we weigh according to our body structure. But then, how can we lose weight? Now, I'm not going to sit here and give you guys a nutritional plan of how to lose weight. What we're going to discuss is 4 key ways to drop blood pressure. But before that, I want to kind of help you guys. Now, there's too many people these days consuming processed foods. Processed foods are something that we shouldn't consume. Now, processed food is canned food, frozen foods, fast foods. Those are things that we need to stay away from, especially if we are overweight. Let me give you guys a quick example. There's nothing more hilarious to me when I see a patient and they tell me they eat healthy and they're eating canned beans. Now, these canned beans should only be emergency food. We have maybe half a dozen, and we bought this during the height of the pandemic, because you were just scared. You don't know if we were going to have food. You know how news can be. But these canned beans have 410 milligrams of sodium. So by default, when you make these beans, you're going to at least eat a third, if not even half. So a third of this is about 137 milligrams of sodium. And then plus, if you eat this, then you're probably adding more salt to this, and you're maybe adding more salt to your other types of meals. And one of the leading reasons of high blood pressure is excessive salt. And if you have high blood pressure, well, you need to reduce your salt intake. But I wanted to show you these canned beans, because a lot of people sometimes don't know that these beans have a lot of sodium. So now look at these bag of beans. These bag of beans have 5 milligrams of sodium, and this is what we make at home. They do take a little longer to make. You put them in water the night before and leave them in water, let's just say 10 hours, 12 hours. The next day, then you maybe cook them for about 40 minutes, and they're good to go. They're extremely healthy. That's the difference between canned food and good food. So you need to get off your processed foods, no canned foods. You need to get off your frozen foods and fast food, and start eating a little bit healthy. But at least if you stop eating processed foods, that's going to help you a lot. But anyway, so let's discuss 4 ways to reduce blood pressure. Now, the most important thing in life, and I've discussed it in this video before, is breathing and sleeping. So sometimes when we have anxiety and our blood pressure is high, they always tell us to breathe. But a lot of us don't know how to breathe. Now, it's important that we understand that Our body needs oxygen, but the right type of oxygen that it needs is the one that comes from the nose, because our nose acts like a filter. It can filter unnecessary toxins that can go into our body, so we need to breathe through our nose. A lot of people breathe through their mouth, and when you breathe through your mouth, you get yourself in trouble. You can get sick because the mouth has no filter. So you cannot breathe through your mouth, you got to breathe through your nose. So the first exercise that we're going to do is we're going to breathe through our nose. So we're going to take a deep breath for about 3 seconds, right? We're going to hold our breath for about 10 seconds, and then we're going to release it slowly. Okay, so here we go. We're going to hold it for about 10 seconds. Okay, let's just say the 10 seconds are up, and then we're going to release slow. Okay, again. Let's just say it's 10 seconds. Now, if you do that about 10 times, I guarantee you that it's going to relax yourself. It's going to help you relax. It's going to help you drop blood pressure. Even when you go to the doctor's office and they take your blood pressure, they say, oh, breathe, but you got to breathe properly. It's going to reduce your heart rate, and it's going to relax you a little bit. See, I just did it twice, and I feel relaxed a little bit. That promotes more oxygen to the central nervous system, which is your brain. It promotes more oxygen into your arteries, and your arteries needs oxygen. So anyway, you do this a few times, and it's going to help you relax, and it's going to help you with your heart rate and your anxiety and your blood pressure. But you have to learn how to breathe. Remember, breathe through your nose, you don't breathe through your mouth. And another way that we can reduce blood pressure is by, if you look at your wrist, right? Look at the lines in your wrist here. Actually, I have a watch here. Let's do it this way. Look at the lines of your wrist. You take 3 fingers, put them at the lines of the wrist, and then the 3rd finger, there's a trigger point there, in between your tendons. Okay. Now, all you want to do is 3 fingers. Put your finger in between the tendons there, and that's an acupuncture. That's a trigger point there. The acupuncturists use sometimes. And you press on that a little bit, and that's going to help the heart rate drop. That's going to help you relax. That's going to help you with your anxiety. That's going to help you with your blood pressure. Now, sometimes I do both of them at the same time. I have my thumb, right, 3 fingers away from the lines of the wrist. I press on it, and I breathe, and I feel much better. Now, sometimes when I'm driving, I'm breathing, and I feel much better. Or even you can do this throughout the day. Breathe properly throughout the day. Remember, you never want to breathe through your mouth. You want to breathe through your nose. Okay, so that's 2 key ways that you could do to reduce blood pressure. So another way that you can reduce blood pressure, if you look at your hand here, okay, and in EMG studies, this muscle here in between these 2 fingers is called the FDI muscle, but this another name for it is the web here, right? Right in between your 2 fingers, you press on that a little bit. It's another trigger point that acupuncturists use, and you press on that for a while. Put a little pressure on it, and that can also reduce your blood pressure, and that can also reduce your anxiety and your heart rate. Do that for a while, and that can help you a lot. So another way that we can reduce blood pressure, if you take your 2 thumbs, right, okay, and you find the back of your head, right under the bony part of the head, you have a hollow part. Okay, so you feel your bones of the head, right under that bone structure of your head. There's 2 hollow parts back there. Okay, you put pressure on that, and that's going to help. That's going to promote more blood flow, and it's going to help you with blood pressure. So there's a lot of techniques that you can do to be able to reduce blood pressure. But what I'm going to discuss with you right now is something very, very key. Now, the most important thing in life that I have mentioned before is breathing and sleeping. Now, since breathing and sleeping is the most important thing, what do you think that we should do? We should track our sleep. We should know exactly what's going on in our sleep. If we don't sleep properly, if we don't breathe properly, we can actually be increasing our blood pressure while we sleep. We could be increasing our heart rate while we sleep. And we can be getting sick while we sleep. And then all of a sudden, we don't know all of a sudden why we have high blood pressure, why we have a rapid heart rate, why we have anxiety, and all of a sudden, all along is because we weren't sleeping properly. Now, the only reason that I know about this is because that was my problem. High blood pressure, anxiety, and rapid heart rate. No doctor was telling me why. They was just basically saying that I have a genetic disposition. Now, I'm not overweight. I've always been of good weight, so it wasn't coming because I had excessive belly fat or maybe too much weight. It was coming from my sleep. So what I do now, I monitor my sleep. Okay, I monitor my sleep with this ring oxygen monitor. And all I do, right, I put it in my index finger. Okay, it's connected to my phone via an app. Now, as soon as I put it on, it gives me my heart rate. Takes a couple of seconds. It gives me my heart rate and my oxygen levels. Now, my oxygen levels right now are 98%, which is pretty normal. In my heart rate right now, it's pretty high. It's like maybe 90. I just put it on. Sometimes it starts to go down. It's 90 now. Now it's going to 89. Now my heart rate's at 88. So this is actually key because you have to know. It's important that you know your oxygen levels. Now, sometimes when we get sick, our oxygen levels drop. But when we sleep, it's important that we maintain good oxygen levels, because if they drop too much, that's not good. If our bodies, if your organs, if your cardiovascular system, if your heart does not get the right type of oxygen, we can get sick. Remember, we breathe through our nose and it goes into our lungs, and then from there it goes into the heart, and the heart is responsible for pumping oxygen into our vital tissues and organs. So if you're not getting enough oxygen into the lungs, and then the lungs can't promote the proper oxygen into the heart, and then the heart can't promote the right type of oxygen into the rest of your body, into your tissues, what do you think is going to happen? You can get sick. See, if you know exactly what's going on in your sleep, then you can make the proper adjustments, and that's basically what I do. Now, obviously, I have low levels of sleep apnea, and this is a key way to control that. But even if you do not have sleep apnea, you could be snoring. Now, what happens when you snore? That means you're breathing through your mouth. So if you're breathing through your mouth, then you're not getting the right type of oxygen, and you're not getting the right oxygen going into your cardiovascular system. And then you can wake up anxious. You can get anxiety. Over time, you can develop high blood pressure. You can develop a rapid heart rate. So what this thing does, you put it on right before you go to sleep, and it's connected with the app. And then what it does is the next day it gives you a full report, and it tells you if your oxygen levels were level, if your oxygen levels were good, or if they drop, maybe while you were sleeping. And then you can see that. If they drop a little bit too much, then you can make necessary adjustments, because you want to wake up fresh. It can tell you your heart rate. Can you imagine, let's just say you're sleeping and your oxygen levels are dropping and your heart rate's increasing, then that's not good. Then you need to make the necessary adjustments. So what we're going to do is I'm going to show you a couple of reports of the way this thing works, and then we'll take it from there. Okay, guys. So I'm at the screen here real quick. So the first thing we're gonna do is look at the top, right, where it says SPO. All right, and you're going to see my oxygen levels here, right at the top. Now they're pretty good. They were pretty much touching 100, and if you look at the average here all the way on top, it's about my oxygen levels were 97%, which is really good, and my lowest oxygen level, which is, it says here lowest APO, is 95%. That's pretty good. And I had a perfect score. It recorded almost 2 hours. You see here, recording time, an hour and 55 minutes. And my average pulse rate was at 68. So that's actually pretty good. I didn't have a problem there, and I was pretty happy with that score. But it's not good. It's not good all the time. Now let me take you to another one. Let me take you to this one here that I had a couple of drops. So now my average oxygen levels were 96% on this one, a little lower, and my lowest was 92%, but you know, it's still pretty good. Maybe I opened my mouth a little bit, I don't know, whatever the situation was, but I had a pretty good score all along. I mean, I didn't fall behind 90, and my average pulse rate was at 62. If you look at the heart rate here, all the way at the bottom, you see it's touching 60. Then it kind of nipped 90 a little bit, and I guess maybe sometimes you could be dreaming, or there's a lot of reasons why your heart rate can increase. But when it happens on a consistent basis and it goes over 100, then that could be a problem. So let me take you to where I had one time I had 11 drops. Now this one, I had a lot of drops here. Okay, it recorded within an hour and 17 minutes. I had about 11 drops, but it's not too bad. It didn't fall below 90. So my average oxygen level, you see it here, it's 96%, which is good. And my lowest was 90%. My heart rate was at 67%, which is pretty good. If you look at my heart rate all the way at the bottom here, it's nipping 60 the whole time, and maybe it goes a little bit right under 90. So that's actually pretty good. Now, why this happened, I think I woke up and I was on my back, and my mouth was open somewhat, just a little bit, but it was under control. So now this is where it can get interesting, because if you have this amount of drops in an hour, but it's nipping 80. See, mine is not even, it's barely nipping 90 at times, but yours is nipping 80 or falling below 80, and that could be a problem. And this is something that you have to adjust instantly. You have to kind of recover from this instantly. Also, if let's see here, if your pulse rate, let's just see your pulse rate. My pulse rate here in this diagram it's an average of 67%. Let's just say your pulse rate at one time it increases above 100, 120. That could be a huge problem. So you see why it's important that we find out exactly what's going on in our sleep, because you don't know. You don't know if your oxygen levels are dropping way below 90, maybe a little below 80, and that could be a situation that you have to correct instantly. You don't know if your pulse rate is increasing while you're sleeping, and if it is, then it's something that you have to correct. Sleeping. Now, obviously, you have to correct automatically. And obviously, you know, I sleep in a good position. I do a lot of different things. And if you look at my videos, then you see the things that I have done. Now, I forgot to mention that I'm going to put a link in the description if you want to buy the oxygen monitor. I have a link where you can purchase. You could definitely support my channel with this, but I mean, I think this device is extremely important, especially, let's just say, if they tell you that you need a sleep study. Well, you can give yourself an abbreviated sleep study, because the most important information, the oxygen ring monitor is going to give it to you. But anyway, guys, this is what I use to track my sleep, and I can make quick adjustments. But for the most part, my sleep is pretty good. This is the worst score that I ever had, and I think that for this amount of period of time, I was sleeping on my back. I remember I woke up on my back and I saw 11 drops. I think the most drops I'd have is always, if you see here, look, January 30th, 2 drops, and then no drops, 1 drop, 1 drop, 1 drop, 11 drops, no drops, 2 drops, no drops. There's another one here, was pretty good, no drops. And your oxygen levels are going to drop a little bit while you sleep, but the danger zone is when they fall below 80, and your heart rate's increasing above 100, then something is going on. So I definitely recommend this device. And let's go back to the video. Bye-bye. All right, guys, so I hope that the report was able to help you, kind of give you insight as far as the things that can happen, and also the benefits of wearing this ring oxygen monitor, because it can give you key information and it can help you take care of your health, because then you can make necessary adjustments. There's a lot of ways that you can control if the way you breathe, and if you don't want to breathe through your mouth, I've made lots of videos. If you have any questions or any comments, then please feel free. Now remember, the purpose of this channel is to provide you medical care solutions and diagnostic digitized information so you can make good health decisions, so you can stay healthy, and you and your family members can stay healthy. If you like this video, please press a like, again write a comment, subscribe if you haven't. We're going to develop a lot of content when it comes to blood pressure and anxiety, and we're going to introduce digital products that can help you stay healthy. Anyway, guys, with that being said, I'll see you in the next video. Bye-bye.